So the agenda for my hour is just talk about who's here, and how many are care partners here? So Stacy tells me about 1/3 people, okay. And everybody, some family? Other family, other care partners, okay. And diagnosed with Parkinson's then? 2/3, okay. All right. First thing we're going to talk about, and then we're going to talk about relationships. We're going to talk about sexual communication and communication. We're going to talk about intimacy. I'm going to give you some activities. I've got some great activities. I've got a table full of some things, and it's just a drop in the bucket to what there are as far as activities for intimacy. We're going to talk about support, some resources, and then again, a 15-minute opportunity for questions. So one of the things I like to start with is myths. There's a lot of myths when we're talking about sexuality and sexual health out there, and about different illnesses, diseases, conditions. So these are some that we hear a lot. Lots out there, right? So relationships. For those of you that are here in a couple, you have a relationship history together that no one else would know except for the two of you. And if we're talking about that in a sexual context, you also have a sexual history together. So that might mean that it's a look or a touch or a gesture or a word that means you wanted to be sexual or you wanted to be intimate with that person. And again, nobody would know that but the two of you, right? So that's pretty special. And sometimes if there's a change going on from a disease, illness, or condition, it can impact sexually speaking, as I said before. And so it sometimes then becomes an issue where you have to change how you normally do things. That history has to change, and you have to be able to communicate about the different changes you may be feeling physically, emotionally, or what have you. And sometimes that's really, really hard to do. So I'll give you an example. In my practice, a certain group of people I tend to see a lot is people who men have diagnosed with prostate cancer. And they tend to be a little bit older when their diagnosis occurs. And for many of them, with that demographic, age demographic, they have never talked, or their partner, they've never talked about their sexual health. They've never talked about what they do sexually. Again, it's been a look or a touch or a gesture, not so much the words. And so they really, really have a hard time now having to communicate with their partner about what they're feeling and what's going on for them physically, because they just don't have the words. They didn't grow up with the words. Whereas if I see a young person, say maybe 20 to 30, they'll tell you what they want, when, how often, and why. And which, that's great. Sometimes, it's a little too much, and we have to learn how to scale that down a little bit. But it's about trying to find that balance. And using those words and having to communicate sexually is sometimes just a huge, huge, insurmountable deal to somebody. It seems such an onerous task to be able to do that. And that's what we work with people to do. One of the things, one of the comments that were often given to us is, I'm 70 years old, I have never talked to anybody about this. So we're often the first person that they're speaking to about this. And that's very humbling for us that we're allowed into a person's most private area, really. So I wanted to have sort of a group discussion about what you think the different relationship roles and responsibilities are in your own relationships, or in relationships in general. If you don't want to personalize it to yourself, if you can kind of give me a few different things, and I want to write them down, okay? So just from the audience, if you can kind of give me some ideas, not right or wrong, it is what it is. So what you think some of the relationship roles should be if you're single, what you imagine it to be in your next relationship, what it was like in your previous relationship. Anything is of value. So again, there's no right or wrong. So what do you think are your roles within the relationships and your responsibilities to one another and to yourself? And Courtney has the microphone if you need. Anybody?
So this is not like domestic stuff, it's more like between the two of you?
That's domestic? Yeah.
Well,
like what's your response? Are you with your partner here today?
She's not here.
Okay. So what would be your responsibilities to that relationship that you have with her? Just a couple.
Well, like supporting and like emotional support, but also like the more mundane, like financial and
That's okay.
household chores and stuff like that.
So running the household.
Yeah.
Okay. Anybody else? Often, a lot of people say we're CEOs, we're co-CEOs in our house, right? We're running the household. That includes children, financial responsibilities.
I think we always say we're a team, but really one's more of a communicator, a talker, and one's more of a listener.
And who might that be? Which gender might you be referring to?
But not always. Mostly.
Not always. That's true. That's true, not always. So you try to be a team, you try and talk, communicate, but sometimes it ends up being a little bit of an imbalance with respect to who does more. Is that okay? So your team communication. Okay, we're going to get more into some of the qualities that within the relationship in a little bit in one of the activities. Anybody have anything else? So basically, you're all in agreement that it's a co-relationship, right? With equal contributions from both genders, or if it's same gender, that's fine. There's obviously, you're both contributing to that. Is there sometimes an imbalance not only in communication, like you say, is there an imbalance in, oh, sorry, that's way.
Well, they say sometimes opposites attract, and so sometimes one person might be a good listener and the other one's a good speaker.
Good, yeah, for sure, absolutely. And you know what? When you're listening and talking, somebody you can't both be doing the same thing, right? And that's often the basis for a lot of strife in a relationship and concern in a relationship or issues, is that somebody tends to do all the talking, somebody's doing all the listening, and it doesn't tend to have that equal balance of listening and talking. Because often, and I'll bring this up later, but often when we talk about communication, we think communication is talking. But equally as important is listening, right? So that kind of gets pushed aside when we're talking about communication. All right. Anybody not agree with what I wrote? Relationships are work. Anybody? Who agrees? Let's just see. Right, okay. So when I say relationships are work, they are work, but it doesn't have to be this onerous work. It's something that you need to pay attention to. A lot of times people assume that because you're in a relationship and the dynamics of a relationship, that it's autonomous. It doesn't need it to be paid attention to. And that's not true. I can tell you it's not true after 21 years of talking with people and working with them on relationships. Because not only do I work in sexual health, but I work in relationships with relationships as well, because you can't really separate the two. You know, what always amazes me is that in life, in a lot of the people I see, we're very good at paying attention to our life and scheduling things in. We schedule doctor's appointments, we schedule dentists, and we show up, right? It's a very bad thing if we don't show up to the dentist and just don't call or anything like that, or don't show up to our doctor's appointments. However, one of the things that we don't do is we don't schedule time with each other very well. Some people do it better than others, and other people don't do it at all. We schedule things for our children. We get them to their sports. We get them to whatever activities we need to do. And we go to our job, right? We're pretty dedicated. We show up to our job because we have to. So why don't we show up to our relationship sometimes? Why don't we schedule time? It's one of the simplest things you can do. And it reminds me of a couple. My oldest couple that I've ever seen, they are 88 and 90, okay? And they were seeing me because of not so much relationship issues, but more sort of sexual response or sexual functioning issues. And I picture them as I'm talking about them now. And I said to them, so we had our hour. I have the luxury of having an hour-long consult with people, which is great. And so I said to them at the end, I said, can I ask you a question? And they're like, sure. And I said, so you've been together, I guess it was 60 some odd years, more than that. And can you tell me what makes it work for you guys? Like, can you give me something I can impart onto the people I see? And they said what they do is, I guess at one point they did have some issues a long time ago in the relationship, and they looked at a 24-hour, they looked at a clock, and they said, okay, in a 24-hour day, if we can't spend half an hour just to be together, connect, just sit, talk, and connect, talk about your day, whatever, then that's a really sad state of affairs. And I wholeheartedly agree. In a 24-hour day, if you can't schedule you put time in for your job, as I said, you schedule things for your kids, your own appointments, your sports, hobbies, whatever. If you can't, for one of the most important relationships in your life, if you can't carve out half an hour, I personally find that sad, right? So they started doing this a long time ago, and they call it going to the couch. So that could mean different things. However, in the context of what we were talking about, what they meant was they would somehow find a mutually agreed upon time in their day, and they would go to the couch. In other words, they'd sit, turn off TV, outside distractions, and they would talk about how their day was. And just connect, just talk. Not watching TV, but actually talking. Just sitting there talking. Sometimes they didn't have a lot to talk about, so they would just be together. Sit, whatever, go outside, go for a walk, whatever. But it was that half an hour. They'd start on the couch, and if they decided, you know what, after they checked in, I feel like I don't have much more to say right now. How about we go out for a walk? Okay, go for a walk. Or they, made that time and they dedicated that time. At some points in their life, depending on what was going on, they would set, if it wasn't going to be possible to do that at the end of the day as an example, they would set their alarm a half an hour early before they really needed to get up. And they would just have that time just to connect, do whatever. So again, I think that's a realistic thing to do. A lot of times too, when I'm talking with people and working with people, I often use a house analogy. And how I use that is, I say that the people in the relationship, you're the foundation, you're the concrete. I'm not a construction I'm just guessing. You're the concrete that gets poured, the foundation. And the framing of the house is like who you populate the house with. Is it your children? If your parents live with you, your in-laws live with you, is it your sisters, brothers, that kind of thing? And then you put up the drywall and the electricity goes in and all that other stuff. But you two and what you form together in your relationship, you're the foundation. And so if over time the ground settles a little bit and there's cracks in that foundation, you're going to leave it? Because what's going to happen if that crack doesn't get fixed? It's going to get bigger, and it's go other places and may form new cracks. So you get my point, right? So you two, or those of you in couples, you're the foundation, and so you need to nurture that foundation, which goes back to what I said before, and trying to carve out that half an hour and go to the couch. I'm sure they use the couch for other things, but they didn't tell me about that. So with any sort of illness or health diagnosis, it often creates an opportunity to redefine what relationships mean to each other and what that looks like for you, okay? So it's an opportunity. If you can look upon it as an opportunity to do that together as you go forward. Okay? Now the different components of a relationship, these are pretty well, in my opinion, are the three different components of a relationship. The one thing that is missing here is spiritual intimacy. So how we sort of add that is we usually draw it above or around or below and sort of being an encompassing aspect of your relationship. And that can mean many different things to different people. It could mean a higher power. It could be from a religious point of view, whatever you define as spiritual intimacy. But emotional intimacy, that's things like your actions, touch, checking in with somebody, how was your day, just a little touch, the words you use, expressions of care, compliments, again, checking in on feelings, expressing your feelings, respect, kindness, that's emotional intimacy. Relational intimacy is what you do together as a couple, all right? I'm a big believer in yours, mine, and ours, and what I mean by that is I think it's important for me to have my own interests and what I like to do and hang out with my girlfriends, that kind of thing. And it's important for my partner to have his own interests and sports, whatever, play hockey, roller hockey, whatever. But then there's ours. So the ours part of it is what we do together as a couple. Travel, play cards with friends, whatever it is. So that's what relational is what you do together as a couple, okay? And sexual intimacy is what it is, sexual intimacy. So the activities that you do together and how you express yourself sexually. Now, sexually is at the bottom with these circles, and this is not meant to be hierarchical, that emotional and relational is more important to sexual. Those move around. I just happen to draw them that way. And often when I'm seeing somebody or my colleagues are seeing somebody, there's usually an area that has more strength within the relationship. So we talk with people about, is there any area that maybe the circles, they're not joining here so much. Maybe this is way over here, or this is way over here, because there is some issues or concerns within the relationship in that particular aspect. For a lot of people, and I'm going to stereotype here, I'll just give you as an example, it's a generalization, but for a lot of women, if there's an imbalance or there's some issues in emotional and relational, this is not happening so much, okay? In my experience. Okay. Anybody have anything different to add with that? Okay. It's a generalization, but I have found it to be quite true for a lot of people. Again, so you're trying to look for balance between all three. There. All right, so moving on to sexual health. I'll let you read that. It's put out by the World Health Organization. So I often think of this, sexuality is who we are, okay? So you as Grant, right? Me as Shannon, I cannot see because that light is very blinding. So who you are as a person, you may be a mother, brother, sister, aunt, uncle, son, daughter, parent, right? Who you are and who you are with your friends, which could be different from how you are obviously with your partner, all those things. So you're many different people rolled up in one, which is very special, right? So again, your sexuality is who you are and how you express that. And sex is what we do, okay? What we do. So that's a sort of a good definition. I want to ask a question. What's your largest sex organ? Good. Well, I've had a few different answers to that question. Yes, it is your brain. So how many knew that? How many knew that your largest sex organ is your brain? Okay. It is, but it tends to get left out a lot. With respect to how your thoughts, your feelings, your arousal, how your body responds, your brain is controlling a lot of that and most of those types of responses that we have in our body. So when we're working with people, we really try, and what I'm trying to do today, hopefully it'll come through a little bit, is really try and harness and utilize that underutilized aspect of sex, which is your brain, okay? So we're going to use your largest sex organ today a little bit in thinking about these things. Whoops, sorry. So just a further definition. So this changes. Like when we're young, a teenager, it means, you know, it has I have 3 teenagers, which is a lot of fun. And so this means different things to them, particularly to my 2 oldest boys. Like, I don't think sexuality comes into their vocabulary. They're just shortening it to sex, right? So it means different things at different stages of your life. And what I try and do a lot with them is talk about relationships. Because in school, what they get in school, and if you recall, and it's probably the still same curriculum, is, I know because my youngest just went through it, you get biology, you get body hygiene, okay? You get reproduction. This is what you get in the curriculum, and it is what it is. What you do not get is relationships. And you don't get sort of the nuances of sexual health and sexuality, all right? So it makes me think of a lot of the young people I see. I'm talking 18, 19, 20, up to 30, and beyond. But in particular, I have quite a few young people in my private practice that are really struggling with the societal messages that are out there. So what society says on social networks and media and billboards and movies is that if you're not having intercourse and that it's lasting 2 hours and that you're multi-orgasmic and it's on the kitchen table and there's some fireworks after, then you're not having sex. What you're having is, I don't know, but it's not sex. It's what, you know, maybe you do, maybe you're having foreplay. It's not a word I like, but anyway, we'll use it, foreplay. But what you're having is not sex. And the expectations of such. So a lot of, I see, as I said, a lot of young people who are really struggling with those messages that are out there. And a lot of times the gaps, not only in that information, is in relationships. So nowhere along the line have they learned about relationships and the nuances of relationships and the roles, the responsibilities, those kinds of things. The equality of the relationship. Do you agree? Did you learn anything about relationships unless you took some psychology or something in school or counseling? Anybody? What you learn has been from your experience, right? Your past experiences and maybe things that you've read or those kinds of things or picked up along the way. So when we talk about sexuality or think of this topic, what we try and do is present this to someone and say, okay, this is your sexuality, and these are all the different things that it can include. And for a lot of people, that's really illuminating because they don't realize that, okay, my personality, that is something really to do with my sexuality? Yes, it does. How you communicate, what you think about intimacy, what you believe, what you hold true. Maybe fertility has an aspect. Pleasure, how you've been socialized. What was your upbringing? What was the messaging in your home? Was that something that was not talked about? Those kinds of things. Was it religious based or that? So all that brings you to your present day. So when we're working with people, we do a very detailed assessment and we ask about your past, your upbringing. What were some of the early messages and your values and beliefs? Now, if a certain area of this wheel of sexuality is affected, let's say, for example, body image. So if your body image is affected, maybe by an illness or condition, then there's going to be, this has to change and adjust, and there's going to be some imbalance perhaps, depending on the degree of concern. So you got to recognize that is an important element of your sexuality, and if there is changes to one aspect of that, then it's going to cause some concerns maybe in other areas, and it's going to create some shifting and an opportunity to review that and see how that is. Has anybody ever seen that slide before, like gone around on the internet, email? Do you agree? The women agree? Yeah. It's true. But look we got lots more buttons to play with. Men, not so much, kind of boring, right? You got, just kidding. Right? Look at all those different buttons we have. So this kind of alludes back, I probably should have moved the slide. This alludes back to what I was saying before about the, with the circles. We're different. If you're heterosexual and you're with somebody opposite gender, we are different. One of the things I often do, because I'm a proponent, as you probably guessed, on relationship education, is I often, if people are willing, get my patients and their partners to read about, well, first of all, read about their own sexuality. And I think I included some books at the end as resources. I get them to read about their own sexuality just to give that base knowledge in which to go forward. Then I get them to read about the opposite. If you're heterosexual, I get them to read about their partner's sexuality. And I've not had a bad experience doing that with people. Most people are very happy to, a lot of times they'll come back and they'll go, I had no idea. I mean, I guessed or I thought, I had no idea. Now I get what he or she is saying. So it's a good thing. It's not, I always say no bad can come from biology knowledge. Okay, so I'll let you read that. So what do you think about those statistics? Just in the general population, 51% of women and 42% of men. That's pretty high, right? In one of our clinics, in one of our men's clinics, if we're seeing somebody that has some erection changes, the statistics for that are 40% of men over 40 have some degree of erection changes for whatever reason, and that could be mild to severe. So again, I say that just to illuminate how common these concerns are. And it says sexual concerns are even more common in persons with disabilities, cancer, chronic illness, and mental health. Okay? But it's not something people talk about as easily. It's getting way better. Again, if I look back 21 years, there's not as many people were talking about it or seeking help about it. At one point, my wait list was 4 to 6 months. So that's not good that there's that many people experiencing some concerns in this area, but it tells you that more people are seeking help, which is a good thing. And I think, as maybe controversial as it is, but the commercials for things like Viagra and Cialis and those kinds of things being out there, I think that has created somewhat of an opportunity for people to start talking about it, certainly talking about it to their healthcare providers, which is how you kind of need to get the referral in the first place, right? So I think that's good. And for ourselves, we do a lot of education with healthcare providers as well in this area, trying to increase their comfort. We work with first-year medical students at UBC, and we see them for a month, and we do teach them sexual health so that they're trying to incorporate that in their practice. We get them while they're young and try and encourage them to talk about sex. So some of the possible causes of sexual difficulties are stress, depression, anxiety, medications. A lot of medications out there do cause sexual side effects, particularly the SSRIs, which are the antidepressants, some of the blood pressure medications, sometimes some of the statins for cholesterol, that kind of thing. Relationship problems is also a cause for sexual difficulties. Poor self-esteem, change in body image, sexual self-view, bowel and bladder problems is common. Aging, pain, fatigue, and such. Anybody have any other possible causes that they want to contribute to that? Okay. So going back to your brain, again, with your brain being your largest sexual organ, your desire originates in your brain. So part of it is biologically based, your hormones, but the other part is motivationally based as well, or behavioral, psychologically based. So your sexual desire has all these different elements. If one has pain or the fatigued, do you think their desire is going to be optimal? Probably not. If you're not in the right mood or you have some changes with body image, it's going to impact your sexual desire, your relationship satisfaction, medications, myths, stress. So all these things are impacting your sexual desire. So if you're feeling like that, any of these are influencing you personally, if you personalize this to yourself, then perhaps you can express that to your partner and have a conversation. So for example, if you're a person with spinal cord injury, you may say, or and you're with someone else, they may say, well, I didn't know that you could still be sexual. I didn't know that you could have kids. I didn't know that you can still have erections or that you can still move about with your spinal cord injury. And so if a person started to believe that themselves, that might inhibit them from wanting to put themselves out in a relationship and seek other relationships, right? They may be wearing a bit of that, those myths that are out there. Does that make sense? Yeah. Okay, so it's important you need to talk. I've had lots and lots of couples say to me, you know, truth be known, there are times I just didn't feel like it. And I still did it because, you know, for the relationship or for him or for her, but I just wasn't feeling like it. And I know he could tell or she could tell by my body. My body was tight. I maybe looked like I was looking elsewhere. I was rolling my eyes, and you know, he saw that or she saw that. And I often equate that to a couple having that cartoon bubble above their head, like you see in the Saturday morning cartoons, or and they would have their thoughts about being sexual with their partner, maybe again, just because they're not really feeling like it. Their mood is off, or they're in pain or fatigue, and they're not sharing that with their partner. So they're going through the motions, but really, at the time, they just want it to be over. That's not kind of what they wanted to be doing at this point. And I'm saying, well, let's find a way to help you communicate that in a respectful way, right? You're not going to just say it in a disrespectful way, because that's not helping anybody. But trying to say that and communicate with your partner, you know, it's 11 o'clock at night and I'm just so tired, and this is just not the best time for me as much as I'd like to. Could we maybe look at another, maybe tomorrow morning or whatever? And talking about that. People don't, right? And the other thing too is with those cartoon bubbles, often if we're not talking about it, human beings, we're left to our own devices to assume the message, whether it's be body language or maybe an action or a word that you said. And as human beings, we tend to assume the worst, right? We don't think, oh, maybe she is tired. Maybe that eye rolling thing wasn't really meant for me. Maybe, you know, or whatever. Like, if you don't get those messages out of the head, who more important to share that with than your partner, right? And just simply saying, you know what? Again, I'm really tired. It's been a bad day. I'm in a lot of pain. My back's really hurting. Can we just hold each other, or can we do this, right? Put it on you. I am in a lot of pain. Can we do this instead, right? Is that reasonable? Is that reasonable to expect to be able to do that with one another? I think so. Again, if it's done from a place of respect and it's not done in a negative fashion, you're communicating what needs to happen for you at this particular point because of how you're feeling. So this is an actual sexual response model done by a colleague of mine named Dr. Rosemary Bisson, and she devised this model. So basically, it's showing you the different psychological and behavioral or motivational drives to be intimate. What happens? It's part of a sexual response cycle. So you may have a thought, which you probably can't see in the middle. It's a spontaneous, innate desire. So you may feel an urge, or what we call that is biological drive or horniness. You may feel like that. Then you kind of ask yourself, you don't really necessarily think about all these things, but you kind of go through the motions. Well, motivation. Well, I know if I do engage in sexual activity with my partner, it's going to feel really good. We're going to feel that emotional connection. Again, the yellow part that you can't see there is the willingness to be receptive. There's some sexual stimuli within an appropriate context. Again, this is a mutual context. There's some physical arousal that happens with your brain and your body. And so your heart rate increases, your breathing gets a little bit faster, you get a little bit flushed, you get a little bit sweaty, or glow, whatever you want to call it. And arousal, your body kicks in, it takes over, and then it goes back up to emotional and physical satisfaction. All right? Sometimes what happens for people is that it may not be a biological thought that's occurring that makes you want to be sexual with another person. It may be a suggestion from your partner, but what could happen often at that point is what we call responsive desire. So it may not be your idea, But once you kind of get into it, then your body and your mind take over and your emotions, and you do enjoy the time together, right? And often I've heard people say after, you know, once I kind of got into it, it wasn't my idea, I kind of maybe didn't really feel like it, but you know, I could be swayed. And we did, and I left myself questioning myself, well, that wasn't so bad, like why did I not want to in the first place? And so that whole responsive desire kicks in. Again, it wasn't their biological desire, but it was their responsive desire, because your body started to, and your mind followed suit, wanted to engage in sexual activity. Okay, so when we think of sexual health, we think of all these different aspects of self, all right? We use it as a basis of our assessment. So we talk about how's your drive, how's your sexual interest. Some people call it libido. Sexual functioning, your response. How is your body responding? Are you lubricating? Are you, is your heart rate increasing? What are your thoughts at that point? Are you having sexual thoughts, fantasies, that type of thing? Or do you have interest? Are you interested in your partner still? If you're reading a book that has some sexual content to it, does it pique your interest, or is it that doesn't at all? That doesn't pique your interest. Do you have more of a low drive? What's going on there? Is there any bowel and bladder issues? Sexual functioning, the nerves for some of your sexual responses are very closely linked to your nerves for bladder and bowel function. So there could be some changes. For example, in a particular population of people I see, they have what's known as climacturia. So when the fellow has an orgasm and he ejaculates, he actually ejaculates urine. So that's an issue for them as a couple, for him as a person and for them as a couple. It can be. Motor and sensory influences. Is there any changes there? Do you still feel the same? Is there some numbness, tingling? Are you able to still use your movements for engaging in sexual activity? Is it an issue of having to adjust and use different positions? Maybe the missionary position doesn't work so well anymore because you need a lot of upper body strength if it's a man on top, or if it's a woman on top, you have to be able to keep your body on top and upright and use a lot of trunk movement. Is that not possible anymore? So talking about that. Factors specific to the condition is, for example, with Parkinson's disease, how does that affect you sexually, right? How does that impact you? And having that conversation with your partner on what you're feeling and about all this, and your motor abilities, your sensory abilities. Partnership issues, if you're in a different relationship now where you're having to provide some care for your partner, has that kind of changed the dynamics of your relationship a little bit? And that's something that needs to be discussed. Keeping the bedroom maybe more for intimacy as opposed to anything medical, trying to, if at all possible, remove some of the medicalization of the bedroom, change that up a little bit. Sometimes too, when we're working with people, we suggest different devices or erection enhancement options as an example, and that's maybe completely new to you as a couple or you as a single person, and how do you sexualize those things? Okay, for example, I'll just give you one as a vacuum pump erection device. That's something that a lot of men have to use to create an erection and sustain the erection. And how do you sexualize this new piece of equipment that's in your house? All right, and that's a conversation for the two of you to have, and if needed, then we help you with that conversation. Sexual self-view, self-esteem. Do you look differently now? Do you respond different physically now? Again, is pain an issue, fatigue an issue, sweating, muscle rigidity, shaking, all those kinds of things? Does it take longer now to have an orgasm? Or sometimes when a person's been diagnosed with Parkinson's disease, sometimes there has been some potential changes with ejaculating too quickly, right? So again, all those kinds of things. For some women, there's some vaginal pain because of dryness, changes with lubrication. So is that a concern for a person? So there's lots of different things, and you know, you may have read about some of the different potential changes, but then how does that impact you personally? And again, having that conversation with your partner. So this is the definition of intimacy from Merriam-Webster. Okay. I wanted to get you to sort of think about this. How do you define intimacy? And I was actually going to get you to shout out to me again using paper the different benefits of intimacy. But because there's not much time left, I think I'm going to leave this. And I think this is a really good homework activity for you to do at home. And again, if you're a single person, you can certainly do this. And looking at yourself and what it means to you and what the benefits are. So again, I'm going to give this as homework then, if you would, please. How would you define intimacy? And then share that definition with each other. What does it mean to you? And the benefits of intimacy. And at that point, maybe you could talk about your Miller intimacy scale. That's a pretty personal thing. Some couples choose not to share that, but reflect on it and maybe use it as part of a conversation and it may have identified some areas where within your relationship that you think you could maybe use a little work or work on. All right? So enhancing intimacy. These are some of the things to be aware of. Taking the time, as I said before, if you can try and schedule. I know a lot of people say to me, you know what, I want my sexual expression or my intimate times to be spontaneous. And I get that, I understand that, and that's a really strong value a lot of people hang on to. But, the other side of it, the flip side of it is how much in life is really spontaneous? Now, I don't know, not much, I find personally. Both people are working and you got kids maybe, or you're caring for a parent or caring for your partner even. So there's not a lot that allows for spontaneity. However, what I say to people is, if you can just carve out the time and then you've set that aside, then what you do together with intimacy, that can be spontaneous. Okay? So at that point, you can bring in spontaneity, if that makes sense. Using all your senses. So touch, smell, setting up the room, candles perhaps, incense, that kind of thing. Using your smells for that, so that's using your sense of smell. Touch, look, all those things. Like trying to think outside of what you normally do and try and incorporate other your senses into your intimate times together, all right? Using different sex toys or aids, whatever. And that could be lots of fun if you haven't. And it doesn't have to be, going back to that myth, I have had some people say to me, well, then people will think I'm perverted going into an adult store. There's one that I'm thinking of on Burrard. It's called Art of Loving. You would not know, it looks like a coffee shop. You would not know you're going into a sex store. There is another one that we go to get some supplies. It's on Davie. Yeah, okay, it does look like a sex shop when you're going in there, but there's other ones, and there's tons of people in there from all different walks of life. So you just go in and take charge with your MasterCard. And the Art of Loving one, they have courses, by the way, on Art of Loving. It's on Burrard and 5th, I think it is. Again, you would not know it's a sex shop when you're driving by. Maximize your potential. What are you good at, right? What do you have to offer? Maximize that. Adapting to limitations. We're all sexual beings, so if you don't adapt, then you're missing out on a lot of the potentials here, right? To feel good and connect with your partner or another person. Remain positive and open-minded. And, I think a lot of that, too, is incorporating your ability to laugh. If something doesn't go the way you envisioned it or planned it, then, you got to look at the big picture, and is it a laughable moment? Like, not laughing at the person, obviously, but using that opportunity to find some humor in what you were trying to do if you're trying to incorporate a certain device or that kind of thing, or a sexual aid, and just, oh, wow, and having that laughter's best medicine. Reduction of goal-oriented sex. So what I mean by that is oftentimes people think that if they're not having intercourse, they're not having sex. And that's just not true. Intercourse is just one aspect of that. And so trying not to have intercourse or making love as your goal. Just spending time, I've had lots of couples say to me, you know what, we just spent the half an hour just kissing. I think teenagers do it right. If they're not ready to sort of branch out into more types of sexual activity, they'll spend hours just kissing. right? I mean, I'm sure we can all sort of recall, perhaps, in our teenage years. I mean, your mouth, you'd come back after you see your parents at the end of the night, and they're like, why is your face so red? Or when the guys started to get whiskers, you get like all whisker burn here when those young guys are starting to get a little bit of whiskers and shaving. And, you know, you'd spend hours, and we don't do that. We don't. We tend not to do that. And I have some colleagues of mine that they'll argue that kissing is the most intimate thing. They'll say that's more intimate than making love. All right? So just think about that. And being pleasure-focused, intercourse, outer course. So intercourse is intercourse, outer course can be anything you want it to be. Touching, kissing, caressing, holding, mutual masturbation, whatever. Right? So just be more focused on pleasure. Having a bath together, that is being intimate. Having a shower together, washing another person's hair. It is what you want it to be. Right? There's not it doesn't have to be this set thing that society says it is. Again, learning about each other's sexuality. If there's been change, how are they feeling? What does it feel like for them now? How can you work with that? What are your thoughts about that? And lastly, have fun. Because you know what? You get another day to do it again. So if it didn't go good on Sunday or how you thought it was going to be, and you had a little chuckle about that, there's Tuesday, there's Thursday, there's Saturday, right? You have other days. And there's 365 days in the year, so you got lots of opportunities. So different activities. Sensate focus exercises are, they're not goal-oriented, they're just designed to have one person is a giver, one person is a receiver, and it is quite directive in what the handout I'm passing out. And you take turns. So on Monday, let's say one person's a giver, one person's a receiver, and it's the job of the giver just to touch. And the receiver says how that feels or doesn't feel. So it's kind of like body mapping, getting to be aware of your body all over again. And then the next time, the other person's the giver and the receiver. Okay, it's not goal entry, it's just getting back to your body basics. Date box, love box, this is one of my favorite things. So what it is you get these at the dollar store for a couple bucks. One is a love box, one's a date box. So you actually have 4, per person has 2. So what you do is you fill it with 10 things you want to do on a date. You each do that. But again, you got to consider it's got to be a bit of a compromise. So if you're going to a WWF fight, you want to do that. Is your partner, would they go? Would they be willing to go? So if it's something that they absolutely wouldn't go to or are not comfortable doing, then you got to be respectful of that. Same thing with the love box. So the love box, you put in 10 things you want to do with respect to intimacy. So again, if there's something on there that you know your partner is just not going to do, they're not comfortable doing, then maybe don't put that in there. And then once a week, say, you pick something from that person's date box and you pick something from that other person's love box and you find time to do it. So there's some spontaneity, right? Because you don't know what you're going to be doing. The last thing, Watsu. Has anybody heard of Watsu? It's basically exercise, kind of like yoga-ish, in yoga-type exercises or just movement or exercises done in warm water. So a lot of couples that I know of, they'll go to a pool when it's maybe a little bit quieter, and they'll just move each other's body in the water or do mirrored movements with each other in the body and looking at each other and having that eye contact and moving their body around because you're much more mobile in the water. Any questions about any of these? Okay, I'm giving you lots of homework.
Go practice.
Good. Okay, and again, care partners, I mentioned this already. So can the bedroom, I know this comes up as an issue and I wanted to mention it again in people that I see, is that can the bedroom be safe for intimacy? Can you kind of look at your role and can it be sort of separate from when you're providing care and when you are the partner? Is that something that's coming up for a lot of people? And if so, then let's talk about that together as a couple. And if you need some help with that, then absolutely seek help with that from different professionals that are out there. And again, making a commitment to maintain intimacy. And another question is, can the personal care be done by someone else? I know for a lot of couples I've seen, that's been a possibility where they've needed to incorporate that into their time together, but also for various reasons, it worked for them to have the delineation between their two roles, okay, because of some of their concerns. Lastly, just the pleasure principle. These are just some different options for support. It's on your handout. So there's sexual positioning aids. I have a book and it has 365 positions. I'd be happy to, I didn't put it on my resource list, but I'd be happy to tell you where to get it. Sex toys, devices, personal lubricants, erection enhancement options. And again, these are just to help with some of the potential changes that a person may be occurring for a person. Audiovisual things, books that have maybe some erotica in it or pictures. There's different resources, and this is just a resource list. There's lots. I just grabbed a few for you. Okay. The new male sexuality, that refers obviously to male sexuality that I was talking about before, and the Boston Women's Health book collective, Our Bodies Ourselves, deals more with female sexuality. So that's what I get people to read and then share when I was talking about that. And I just want to thank some of my colleagues gave me some of their slides that I work with at the Sexual Health Rehab Service, which is a referral-based service, and I've left pamphlets at the back. If you want to be seen, this is private practice, and I do work there as an associate. It's called Bianca Rucker and Associates, so that's private practice for sexual relationship therapy. I'm also at my card's back there. I work in the men's health clinic that is referral-based, if you want to be seen. And my colleagues at the Sexual Health Rehab Service at GF Strong, they have a dedicated sexual health service. Of a team of, there's about 5, and they're in various facilities. They can also see you and your partner as with a referral. Okay? So thank you very much for doing that.
Thank you so much.